Jason, and this is Ava, and we are physical therapy assistant students at College in Sequoias. Today we're going to be demonstrating passive range of motion on the shoulder. By passive range of motion, it is motion of a body part or segment within an unrestricted motion only used by an external force. So no voluntary or little voluntary movement. By external force we mean you can use gravity, you can use another part of that person's own body, or a family member or therapist. Times we would use passive range of motion would be within 2 to 6 days after an injury, or post-surgery when you're not able to move that body part yourself, or when you're not able to move it at all, and so, for example, maybe somebody that's in a coma that needs to keep that joint mobility going. When the goals that we're looking for when we're using passive range of motion is to decrease pain. We use it to keep nutrition in the joint healthy and basically eliminate any contractures. Which when we say contractures, a lot of times if you don't use a joint or a body part, it can get stuck in a position kind of like this. Okay, so now we're going to demonstrate on how you can do a passive range of motion at home with a family member.
Yes. So you want to have the patient lay supine on their back, and the first motion I'm going to show you is flexion. What you want to do is get a good grip of the arm, make sure you stabilize it, and get the patient's trust so they know that you're not going to let go of the arm. So I'll support him under the elbow and get the wrist here, and I'm going to bring him straight, his thumb up towards the ceiling, straight back towards his ear. So this is a nice and slow motion. The next one I'm going to show you is abduction of the shoulder. So go ahead and support the under the elbow and the wrist, and what you want to do is bring them straight up towards the wall here, just like so. And you want to make sure not to come all the way up, because then you're going to start stretching the muscle. So the last movement is internal and external rotation, and I'm going to bring his shoulder up to 90 degrees and his arm at a 90-degree angle and support under his arm here and hold the wrist. And for external rotation, I'm going to go towards palm towards the ground, or actually palm towards the ceiling, towards the ear back here. Internal rotation, it'll be palm towards the ground here, just like so. Nice and slow. So that there is passive range of motion of the shoulder.